Okay, good morning, folks. This is the convening of the Central District Board of Health meeting for Friday, October 21st. It is now 8:30 a.m. I'll introduce myself as presiding chair. I'm Betty Ann Nettleton, representing Elmore County, along with Representative Megan Blanksma. And at this point, we will call the meeting to order, have roll call starting with Ada County. Dr. Young.
Jane Young, Ada County.
Raul Labrador.
He's trying to call it.
Okay. Dr. Cole. Boise County. Elmore County.
Here.
Valley County.
Mr. Hasbrook here.
Okay, we do have a quorum represented this morning, so we will proceed with our agenda. Director Duke, are there any changes to the agenda?
No changes to the agenda, Madam Chair.
Okay, thank you. Do we have any persons signed up to comment?
Nope.
No. Okay, proceeding with new business. Oh,
Sorry.
yes.
No, that was funny. I don't.
All right. We will entertain a motion to approve the minutes for our August 19th board meeting. Are there any corrections or additions?
Madam Chair,
Yes.
I make a motion to approve the minutes as written.
Okay, thank you. Else, is there a second? Second. Okay. Any further discussion before asking for a vote? Hearing none. Ada County, Dr. Young.
County, aye.
Raul Labrador. Dr. Cole. Boise County. Elmore County.
Yes.
Valley County.
Mr. Hasbrook, aye.
And Elmore County Chairman votes yes. Those minutes will stand approved as presented. Second on our new business agenda is introduction of new staff by Russ Duke.
Thank you. I'm pleased to introduce our new division administrator for community and environmental health, Curtis Lovelace. He comes to us from a pretty long career with state Medicaid. So he's made a really good move for us and for him, I think. Has a master's degree in public health, and I'll let Curtis share a little bit about himself.
Well, good morning. I'm pleased to be here with all of you.
Welcome.
Thank you. Yes, I've spent the last 17 years working for the Department of Health and Welfare in the Division of Medicaid most of that time. I was the bureau chief over the Medicaid enterprise systems. I worked closely with our vendors for our MMIS claim processing system and prior enrollment system, data transactions, financial transactions. I do have a master's degree in public health, and I also teach public health for BYU Idaho as an adjunct faculty member. I'm excited to be here working with Central District Health and excited to be in this role as the Division Administrator for Community and Environmental Health. Really looking forward to putting my expertise to work and working with our great staff in our counties and making Idaho a great place to live, work, and play. I'm a native Idaho and I grew up in the Twin Falls area. We've lived in Idaho our entire lives and really look forward to continuing to make Idaho a safe and great and healthy place to live.
So are you a football fan by chance? That would really top it
That
off.
was.
I'm a football fan.
There you go.
Yeah. Thank you.
Thank you, Curtis. Welcome.
I appreciate it. Thank you.
Russ, any further introduction? What do you got?
That's it. The last meeting, you got to meet Stephanie.
Okay, we're going to next have an implementation update on our Nurse Family Partnership by Hayden Faulkner, Program Manager. So Hayden, happy to meet you too. I
Yes.
don't think we have met, have we?
Good morning, Madam Chair. No, I don't believe so.
Yeah, so the floor is yours.
Good morning, everyone. So, yes, I'm a program manager. I oversee the Nurse Family Partnership Program and Parents as Teachers and our oral health program and reproductive health outreach and education. So today, wanted to provide an update on Nurse Family Partnership. Next slide. So for the okay. So for the overview, wanted to provide, instead of going through slides that many of you have seen before, I would like to provide a short video. It was produced by the National Service Office of Nurse Family Partnership. It's very good and it does a good job explaining outcomes, but also sharing some personal stories and how it has helped certain moms and why it helped them. Then I'll give a progress update for where we are with the program and how soon we'll have home visitors out in the community. And then I'll talk about our expansion strategy and when we'll have home visitors out in the rural areas. Next slide. So let's go ahead and play the video. Just make that as big as you can, Dustin.
Can we pause it until we get?
Yeah.
Some sound.
While we're waiting, I just wanted to
Hey, Raul. Morning.
mention that Betty Ann and Dr. Young would remember when we hosted the Idaho Association of Local Boards of Health Conference 14 years ago. This was
Yes.
on the agenda,
Yes.
and we had several people speak. Patricia Kempthorne spoke, and it's just interesting to realize, I mean, it's a relatively expensive program because the professional staff that it requires to deliver the services, and it's patience and time and lots of time. And thanks to the board, you guys authorized some jumpstart money to get the program started. And we were able to do that, hire a program manager. We have 2 nurses on staff, and Hayden will talk more about that. And we have a lot of different revenue streams coming in, including Ada County ARPA funding that we are hopefully a short week or 2 away from signing that agreement, as well as money from state legislature that goes to all the health districts, but we get a share of that as well. So
Russ, do you mind me asking how much ARPA funds you get to Ada County?
we are getting about $725,000 from Ada County, and that will run through December 31st of 2024. There will be potentially an opportunity to continue that maybe for another 6 months beyond the end of 2024, where they would obligate the funding, and then we would be able to continue to use that.
So if we wanted to start this in Valley County, that would be where I could get seed money to get it started up there. ARPA funds. How do you maintain it though after the funds are gone?
Well, we have several funding streams. We have the ability to bill Medicaid, which
Oh, okay.
should have been done a few months ago, but we're still waiting for official approval. So that's, I think it's been delayed now till maybe the start of the 2023 with the ability to back bill till October 1st. So we can bill that we can bill Medicaid, but there was some restrictive criteria put in place. And then what Hayden did a lot of work, a lot of research, a lot of data gathering, and we advocated to Medicaid to cover the services if the families meet the national criteria. So that's something that we worked on back in May and June.
Was that the paperwork issue that we were talking about?
Exactly.
Okay.
Yep. And maybe Hayden could speak. I know he was on a conference call recently with Medicaid, and it sounds like they have maybe some staffing issues that are causing the delays to get CMS approval. So we have that, and then we have the state general fund appropriation. We have the Ada County ARPA funds, but ultimately we're hoping to make it sustainable through, billing. A lot of the families we serve are on Medicaid.
How many? Probably all of them, or most of them?
It depends. It depends on in the state, but for us, wasn't it for parents as teachers, was it about 80%?
About 75%.
75%. So, and we don't have the experience yet because we haven't seeing a family, nurse-family partnership. We just have the supervisor and recently hired 2 bachelor's prepared registered nurses. So they're doing the training, and I think within a month or so, they'll be able to start seeing families.
Well, I don't want to delay this, but I think this is probably a similar model that we could use for mental health. More in-home type visitation program. I don't know, it's been tossed around a lot at the county level. The mental health issue is pretty tough.
Yeah.
Trying to figure out how to handle that. And a lot of these people that have issues don't have transportation.
Right.
Okay, sorry, go ahead.
Got video queued up.
Okay.
I'm glad I'm not the only one who was having technical difficulties.
You fit right in.
Yeah.
When I found out I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse-family partnerships intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With Nurse Family Partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated. That's where Nurse Family Partnership comes in.
No solamente la palabra, sino en dos idiomas. I feel like I'm the support for them, but they're learning themselves. And it's amazing how they learn that they have the power, that they're powerful.
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helped him with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Vicky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention and outcomes that are of unquestionable public health and social importance. Since 1996, we've reached over 269,000 families. If you can change a family, you know you can change a community.
We're at this point right now where we have the opportunity to really scale up based on 40 years of success. We're going to reach the scale that's going to make a real impact in this country.
I want to just be the best mother I can be. I know there's going to be challenges, but I'm okay and ready for that.
Madam Chair.
Yes, go ahead, Dave.
Does that paint a good picture of what they're doing? They are in those homes, and to your point, health, not only do they not have transportation necessarily, but they also don't have support within the home. They're often just by themselves. And so having that support early on in pregnancy, prior to 29 weeks, and then ongoing support until the child is 2. And so it really is a long-term relationship, certainly long-term benefits. So I will go to where we're at. So we, thanks again for getting us started with some funds. We utilized them, I think, very successfully. So we had a little trouble getting our RN supervisor hired, but we got that done on June 6th. And since then, we have been, the application process was quite long. We got that approved on July 28th. And 2 months later, we had all the positions filled. 2 RN home visitors who were excellent, and Leanne Somerville is our RN supervisor, and she's been fantastic, not just with the application, which was very long and complicated and tedious, but with outreach and with communicating internally. She's been fantastic. So 3 months, let's see, yeah. Current activity, so they are completing training that's provided by the National Service Office of Nurse Family Partnership. It's required. So they can't quite get out in the field and see families until they're done with that initial training. And we're building a community advisory board, working on our referral network and our funding streams. So in about a month, we can start seeing families here in Ada County. So the plan is to there's still a lot of infrastructure to build within the program, and so we want to focus in Ada County with those first 2 home visitors. And we have a few referrals already. We'll probably have somewhat of a soft launch. I don't want to overpromise and underdeliver. And so we have lots of opportunities for referrals, and so we'll take that a little bit slow, make sure we're not not having referrals sent to us that we can't help, because we can add about 4 to 5 families per home visitor per month. So it'll take many months to get them up to full capacity. We will be fairly aggressive. I think we'll add another 2 home visitors as soon as this spring. It does take, if we're hiring an RN from a hospital, they typically need 30 days notice, plus the hiring process, and then there's at least 3 months of NFP training. So we'll probably hire sooner rather than later, and the startup money you gave us has certainly helped with that, and so it'll help us get a really quick start. And see, next slide. So by the end of June, so June 30th, our team will be completed with our first 2 home visitors will be completed with their initial training. I'll continue to focus on program sustainability. The Medicaid eligibility changes we got through that are quite active basically will mean that we will have more of our Medicaid families qualifying for this program, probably about 20% more. So even though we had 75% of our PAT families were Medicaid, only 40% were being reimbursed because they wouldn't meet that criteria. So that number will go from 40% closer to 75%, I think, which is, we're lucky to have lots of funding sources coming in with ARPA, but that may not, we don't plan on that lasting forever. So I feel like that was a good change. Let's see, I've covered that. Next slide, please. So in July, I feel like once we have our 2,
Can we
go ahead.
back up
Yes,
just a second? If you're collaborating with Medicaid to ensure eligible families are aware, how are we doing the outreach to make sure that people know that they're aware of the service? Because that is, in an unrelated issue, that has become one of the biggest things, is that these programs are available. And I think there's some folks that are in denial that they're available. What are we doing for outreach to make sure that they know that they're available? That's my big question.
Yeah. So I feel like there's 3, like McBee certainly has outreach activities. And we do as well. We have generally when we attend events, we're bringing in several different programs. And that's that's what, I'm glad you brought it up because it's one of the biggest parts of the strategy is building those outreach efforts, not just for referrals, but for reaching those patients. And so we have my reproductive health education specialist is doing things at Interfaith for healthy relationships and that type of thing. But we have relationships like that with community partners that now our nurse supervisor and myself can go out and kind of pigtail on that relationship and let them know about nurse family partnership. So go ahead.
Madam Chair, I was just going to say one of that we're building this out because we have similar challenges with WIC. If you look at national data, it's about 46% of eligible Idahoans eligible for WIC actually participate. So it's a huge gap between eligibility and participation, and we don't know exactly what that looks like, right? We're just really just starting these programs, but one of the things we're doing is working with St. Luke's as a provider of OB care for nurse family partnership, and then OB and delivery and pediatric care for parents as teachers and for WIC. So we're building a referral network with them so that it's more automated rather than you go in and you explain to healthcare providers, and as long as they remember that conversation, you get referrals. So they're committed to helping us with that. And I think that'll be a big deal, and depending on how well that works, our next step will be working with St. Al's and birthing centers and just continuing to build it out, because that's where the interface takes place and the providers understand, you got a first time, maybe a single mom with substance abuse and mental health issues. We don't know that. And we can do all the outreach in the world, but that's very strategic in my mind so that we can get those individuals and families directed to the resources we have to offer. Nurse family partnership, parents as teachers, and WIC is the primary focus.
Is the Department of Health and Welfare cooperating to try to do some of this outreach themselves? I know that we had difficulty with the paperwork where they didn't want to do the reimbursement even though they were required to. Are they helping it out at all when some of these people become eligible for Medicaid and apply?
I don't know. That's something that I would say, like I would say with WIC, for example, every single pregnant woman and child who's covered by Medicaid up through the age of 4 qualifies for WIC. We have always made, that's an area that we could use some better support, I'll put it that way. We're not getting the referrals that we feel like we should. I mean, they have the database. We enter all the data for the families that are currently covered by, served in WIC, called Whisper. That's at the state. And then they have the Medicaid database. And what we've advocated for is to cross-reference those and tell us who's the 54% of families out there and individuals who are eligible. We're willing to do the work. You know, we have community health workers, we have staff, we have no-shows coming in. They could be calling and contacting families to let them know about their eligibility. So, yeah, any help you'd like to provide would be appreciated.
Madam Chair?
Yes.
And it's not just, I feel like there is certainly a lot of excitement on their end about partnering and sharing, because they need that as well with some of their programs. So we're coordinating with an RN just starting yesterday at DHW with hearing loss, and I can't remember the name of that program, but they have 2 programs and they want to collaborate and share where we overlap. Like, what screening are we doing? How does that process work? So it's certainly not a lack of interest. I think they want to. I think as part of our outreach efforts, we just need that frequency. You can't just go have one, educate one group one afternoon and be done. It needs to be on a regular basis, educating each other about our programs and the referral process.
But they're already in the database. We just need to cross-reference that.
That
We
would
have
be an
somebody
idea.
here who used to work at Medicaid. How difficult is that?
The difficulty comes in prioritizing that for Medicaid and resourcing it appropriately within Medicaid. if that can be done and it can be prioritized and resourced appropriately, it's not a matter of if it can be done, it can certainly go and be done. It's just resourcing it and prayer.
That's something I can work on.
Madam Chair,
Yes, go ahead, Ralph.
just a couple of questions. So who exactly is eligible? So explain that to me again.
That's right here. So, first time mom, less than 29 weeks, and low income. So that would be here, they're on WIC, they're on Medicaid.
So just low income, because we kept talking about people who had other issues like drug abuse and.
Absolutely.
So it's just low income. It's not, you don't have to have also drug abuse or anything like that.
No,
correct?
but you're right. Those were requirements previously, well,
Okay.
still currently, on the HRSA, the main HRSA requirements for parents as teachers and nurse family partnership are the same. And they do include substance abuse and things like that, or a member of the military. And so we asked for that change in eligibility because there were families that were low income, they wanted to participate. There was a mental health issue in the home, but that wasn't one of the criteria. So they needed the help, they wanted the help, and they just didn't have some of those other risk factors. So that was a good change.
And follow up. So that was a beautiful video. What does the program actually do for the mother? So when a nurse goes in, how many times a week, how many times a month, what do they do?
Yeah, great question. An average of every 2 weeks, but the frequency can change based on how close the mother is to the birth of the child. And certainly right after, those will become more frequent. And then we would rather have them engaged in the program. And so part of the nurse family partnership model is if mom only wants and needs to see that nurse once a month, that's what we will do. And so we give that flexibility to mom. But early on in the pregnancy, that's where the prevention happens. So it's about screening, it's about education, it's about making sure that they're going to their OB, do they need, resources to get there. So it's helping them be more adherent to their appointments and catching things as early as possible if there is anything to catch, and making sure their nutrition is correct, and preparing them mentally to have a child. There's also education on what their plan is for, what their financial plan is to care for this child after the birth. And so it's fairly comprehensive as far as what they do to help them. They're helping in many areas.
Thank you.
Sure.
So Hayden, what exactly is the income line? Where's 28,000, 32,000 is a percentage of something? I mean, that's what I'm interested in.
It would be the same as WIC.
That's WIC, okay.
Medicaid, yeah. So if they are eligible for those programs, they are qualified.
And what is that?
Some percentage of the poverty line.
Yeah, it's
Yeah.
185% of the
Okay.
federal poverty level. I don't know. It's different, right? One person, two person, depends on the family size. So I don't have the
Right,
income
right.
numbers, but
But I think it used to be around 28,000, wasn't it?
And I guess one follow-up. So is this only single moms or like, it can be couple?
It can be,
Okay,
yeah, as long as it's a first-time mom.
first time mom.
And the reason for the 29 weeks and first-time mom is because with limited resources, limited home visitors, it's expensive. We want to focus on where the most impact can be made as far as the outcomes for the mom and the child.
This is great. I was raised by a single mom, and I think this is good use of government funds. So
So we will have, we'll start off with mothers that we know from WIC. As Russ said, we're working with St. Luke's. They know who their Medicaid patients are. They know the demographics. They know who their Medicaid moms are. And so instead of going out to each clinic and educating providers and nurses, it will be a centralized approach. We hope that will be make it easy for the physicians and the other staff, potentially even automating it so it comes out like a patient summary. So that's very exciting. I think that would be fantastic. We will, in about the start of fiscal year 24, start doing more of a marketing campaign, get out and do more of that and expand our referral sources.
Megan had it.
Yeah, just break. So do we have a solution if someone comes and wants help with with this particular service, but is ineligible? Do we have a referral point for those folks?
Yeah, so we'll either set them up with an OB that accepts Medicaid. And so we'll find resources for them here within our agency. They can certainly have parents as teachers, home visitors go out and see them from in pregnancy out to the age 5 of the child. So, and refer them to WIC, try and get them engaged however we can.
Madam Chair,
Yes, go ahead.
Hayden, I just had a question on the training for these nurses. You said it's about a 3-month process. I'm assuming we pay for that training?
Yes.
And then what's kind of the basic salary of one of these after they're certified? I'm just thinking about how much it would cost if we want to start this in other areas.
So like for what do we pay for it? Like, well, you got hourly rate and benefits, so probably 65,000 a year hourly,
Okay, so the
annual salary
30%
plus
of that.
benefits, and then you have your operating cost, vehicles and things like that.
Okay.
And then a Medicaid reimbursement for a nurse that has 25 families. Let's say 20 of those are Medicaid, somewhere between about $75,000 a year in Medicaid reimbursements.
So in order to grow this program, I think that's where we need to concentrate first is where we're gonna need. I can see this thing getting big really fast. Especially if we go into a recession.
Do we have a per unit cost? Per unit cost.
For a unit cost.
With the wheels and all that stuff, you're
Yeah.
probably looking at 150,000.
I'm just saying breakdown is,
Yeah, I know.
it'd be interesting to know.
We can figure it out. We know it's, X amount of money. It's over $500,000 for home visitors, thus supervisor, benefits, operating cost, and they should be seeing the 25 families per nurse. Yeah, we'd be able to figure that. I mean, we're not covering it with Medicaid, that's for sure.
No, well, yeah, what I'm just
Yeah.
trying to figure out is build out cost. If, to see what, in 80 counties, probably where this is gonna primarily target. I mean, maybe Elmore, Valley and Boise too, but when you look at it, falls below the poverty line for the most part, doesn't have access. The larger part of the population is 80 counties. So my question is just like, because there's going to be an ask.
Mhm.
So I would assume, and so we need a build out cost of what this is per
Right.
unit and what the need is. So if you need, 10 more nurses to supply the eligible folks that are here in 80 counties, what do we have to do to build out? Because
Right.
I agree with Raul, this is a good program and this is a worthwhile use.
Maybe we could have a ballpark figure of that for our next meeting.
Yeah.
Per unit.
Yeah, I mean, we have basically 4 primary funding streams. We have Medicaid reimbursement. And ultimately, it's something we've talked about even with privately insured. I mean, you can have a lot of challenges to be privately insured, and we'd like to serve those families as well, rather than it just being exclusive of just Medicaid. And then you have the federal McBee funding, then we have the state general fund, and then the ARPA funds, which are time limited. But I think the state general fund definitely gives us the most flexibility. It has to be for evidence-based programs, which both Parents as Teachers and Nurse Family Partnership is. So I think right now we feel like we're in a pretty good position, but to build it out more, you're going to have additional revenue because of the Medicaid's like seems to be the most sustainable and consistent, assuming we get that approved ultimately.
But I think Megan makes a good point. If we could figure out what it is per unit, so to speak.
Right.
If I came to you and said, hey, I've got 200 or 300,000 in ARPA funds that I would like to give for nurse practitioner in Valley County. I mean, I need that figure to build it into that budget.
We'll
We
get
just did a second round of ARPA funds just
Right.
a couple of weeks ago.
Yeah.
Quite a bit there.
provide that at the December meeting.
Well, and Hayden, I would like, in terms of Elmore County, we have a large WIC population qualified group on the base. And many of those mothers, are by themselves or, spouse is deployed. So I'd really like that to be, something we're thinking about. And then I wanted to ask too, we talk about moms, we should be talking about families. If there's a male involved, are we encouraging his participation?
Absolutely.
Good,
Great
good,
question.
good.
Yeah. Yeah. And I think for Elmore, my plan would be if we can have a nurse home visitor that can see in just Ada County and have those kind of close together, and maybe that home visitor has 27 families or 28, and another home visitor has, is that a lot? It's a lot. Okay, we'll say 20. Okay, so we'll say the average.
Really efficient people.
We'll say the average caseload is 20. I would have an Elmore County home visitor just have, 14 or 15 Ada County families, and then have some of it in Elmore County, or just total 14 total, but also covers Elmore County to account for that travel time. So
Question, I guess. So is it possible for us to provide training to nurses that aren't necessarily employed by CDH and then use them on a part-time basis?
yes, that's what we did with parents as teachers in Boise County. And so Michelle Graff, our program manager for PAT, put that person through our onboarding process, our training process, the PAT national training process. And we're just paying them. We had a contract, we set up a contract just for that. So we have a template for that.
So there's a potential to do a grant process where we would use existing RNs, we could grant them the money to do the training, provide the
Okay.
do X amount of hours of service with
Yes.
us to try to encourage that, not to have to take them on board.
Right. The key. Go ahead.
Yes, sir.
Follow up, say, kind of piggybacking on that question, what about working with other organizations, churches? I mean, if there's people that want to volunteer, can we do that? They train, obviously nurses that want to volunteer or want to do it as a mission for their church or something. Is there something that can be done like that?
If they meet the requirements for the position, yes. And we were fortunate. Michelle did a lot of work in Boise County with the school and other partners and found a retired kindergarten teacher who wanted to do this. And so it was a perfect fit. So that's the plan for PAT and NFB in Valley County and Elmore. It's difficult to build trust in a smaller community. So let's find someone in the community that we can contract with, and that eliminates a lot of the travel expense, and they have the trust. And so there's less families that would drop off. And so I think it would be a more sustainable model to have someone that's local.
Madam Chair, I had one more question. In our situation in Valley County, like Cascade, for example, we have one full-time doctor and probably 6 or 7 PAs. Would PAs qualify to do this? Because they're always looking for more income.
That's a great question. I believe.
You're laughing. What are you laughing at?
It's a philosophical question because training is very different than a PA's.
Right,
That-
exactly.
That's what I
Very, very
need to know.
different. Are you thinking MA?
No, physician
I
assistant?
think,
Yeah.
Yeah, but the nurse training includes a lot. That's what I was going to ask, the actual nurse family partnership training. Is that about the program? Because
It's
they
about,
should have the
it is
education
a
in there.
comprehensive model that's making sure that it's followed strictly. So there's reporting. They want to make sure that whoever the new nurse home visitor is has the training to have fidelity with the model. And so part of that is having the basic education requirements. But I believe in those modeled elements, there is some flexibility built in for a rural area where that's just not an option. There's not an RN in our community. So I think there is some flexibility in the model that as long as they go through the NFP training and it's really an area where there's no other option, I believe that is possible. Yeah. Good questions. Anything else?
Yes, Jay, don't you know the social workers? I've gotten a couple calls from residency social workers that are asking about.
Yes. Yeah. And so fortunately, Michelle Graff has a lot of network, but we will Like I said, probably start with WIC, and we already do have a few referrals. So we reached out to those moms, and we can't visit them yet, but we're letting them know that we'll be able to start soon and just checking in with them. And so, yeah, it'll be a comprehensive outreach effort.
Awesome.
But I don't want to jump the gun with only 2 home visitors at 4 to 5 each a month. So it'll be somewhat of a slow growth, but I think it's fantastic that in just over a year from when we hired the nurse home visitor, we'll have home visitors in Elmore and other rural counties. So.
Yes. Sorry. What's the reimbursement from Medicaid as opposed to if you build the same codes to Blue Cross or another insurance company?
It depends on the insurance company. So
Right, they Blue Cross.
For Medicaid, it's $250.12 per visit, and that's intended to be just for delivery of service. It's not to cover programmatic expenses or overhead. I don't know what it is for Blue Cross.
Yeah.
And we don't have very many because we're
weekend.
yeah, we're not targeting this, but
Set a goal as to what we're gonna ask for reimbursement.
right.
Can I just say this is quite possibly the best PowerPoint that I've seen in all of my years on this board. Right.
Really?
Oh, yeah. Thank you. It's a compliment.
It was the video. It was because I cut out about half the slides. But that's all I have.
Further comments or questions? Thank you so much. It's been a long time coming.
Yeah.
So we're excited.
Thank
The
you.
hand that rocks the cradle rules the world.
Thank you for your support.
Okay, proceeding with our agenda. Russ, we're going to have Laurel go ahead and give us our fiscal year report.
You're gonna have Bailey Peterson.
Oh, okay. Okay, Bailey, go ahead.
No pressure, but that was really good. So,
All right.
just saying.
Well, Hayden's a great member of our team. We appreciate him, so.
So did you bring us a video too?
Let's say you get the same fiscal update as always, just a new face presenting it. Thank you, Madam Chair, for allowing me to come speak today. We will go over the budget to actual report. This report is through the month end of September. We are about 25% through the fiscal year, and trends continue to be similar to the last report that you guys saw in July, or I guess that was August. Sorry, my mistake. As you can see on page 1, revenues are pretty close to being on track at 24%, so only 1% lower than where we're at through the year, which is good. Our overall expenditures are a bit low at 20% of budget. And then we can just go in a little bit more detail on revenue. So our fee revenue is low at 22% of budget. Sometimes this has to do with timing. There's some cyclical revenue periods that come in, like over the winter, we get a big influx of revenue in EHS. So sometimes at the beginning of the year, it can be a little bit low, but it usually catches up as we get other fee revenues coming in. Other revenue is on target for CEH, and that's due to receiving WICHE contributions and our directly appropriated Millennium Fund contribution that was transferred over by the FCO in July. FCS, the contract revenue is on track with where we had planned, and then fees are a bit below, but it seems like that kind of a consistent trend that we see in FCS, but there is some good work happening over there with planning clinics to bring in some additional revenue. And our other revenue is high, and that includes our home visitation funds that come in through the state, and that comes in as a one-time lump sum payment at the beginning of the year. So it usually meets the threshold of the budget early on in the year. And the expenditures, as I mentioned, they are a little bit low. One pleasant thing to see is personnel is actually on track. And I would probably attribute that to the $1 increase that you all approved in On behalf of the staff, we do appreciate that, so thank you. Operating is a little bit below. That can be due to a lot of reasons. A lot of times we'll enter into contracts and then it takes some time before the actual invoices come in and get paid. So I anticipate that they'll get right back on track once the invoices are submitted and paid for. Capital outlays are low. Again, that's just a timing issue. We submitted an order for all of our vehicles that were approved during the May board meeting, but it usually takes several months for those to be delivered, and then the payment will actually happen in the spring. And trustee and benefit payments are low. This is partially due to the delays in receiving the Ada County ARPA subgrants, because a big portion of the budget for those grants were trustee and benefit payments. And until the funds come in, we can't issue those subgrants to then receive invoices and payments. So if we could move to page 2, Dustin.
I have a question.
Mhm.
So administration and support services, personnel is at 29%, so that seems to be above. And is that going to be a trend that's going to continue? And are we going to have an issue with that?
I don't anticipate that it will, but we'll have to keep an eye on that. Obviously, throughout the year, it's still really early in the year to be able to predict exactly how it's going to go. 3 months in, there's lots that could change. I mean, we could lose a staff member and get lots of salary savings in support services or administration. So it will all depend on retention. If that is going to continue on a straight linear trend or if there's going to be a dip at all. Any other questions on this? Okay. All right, so if we go on to page 2 of the budget tax report, we'll look at the revenue and expenditures in a little bit more detail by program. For community environmental health, we are ahead of the game from last year. It looks like one of the big factors to that would be our food program. So our food program fees had increased last winter, and then there was a makeup billing that had to happen because the original invoices didn't have the $40 increase as listed in Idaho code. So we had a makeup billing, and there were several of those payments that came in July, like $30,000 more than we would have in prior years had we not had that makeup billing. And then FCS is a little bit behind. But as I mentioned, they have a lot of immunization, dental clinics planned, and with Hayden's presentation, the home visitation I anticipate will also increase as we start getting Medicaid revenues coming in for those programs as we get out into the communities a little bit more. Under contracts, both CEH and FCS are higher than last year. For CEH, I would attribute that to the Health Policy and Promotion Group getting additional grant funding, and that is one of those direct benefits of us hiring that grant writer. He's done a great work at getting out and writing really great grant proposals, and we've been awarded several grants through his work. And then under FCS, every single program area, reproductive health, dental, home visitation is at a higher level than we were at last year. So the grant side of those programs are growing at a healthy rate. And then looking at the expenditure side of this report, all of the expenditures are a little bit behind schedule, but as I said, a lot of that can be due to timing, just when invoices get paid. So I would anticipate the next few reports will be a little bit more in line with our original expectations for expenditures. To page 3. All right, this is the cash balance statement report. Our special projects are underway. I know that we don't have any actual expenditures to date, but the remodel is currently underway. Administration is done for the most part. And we have moved on to the CEH side. So we will be getting invoices and you'll start seeing that number tick down this year. Again, just tiny with getting the invoices in. The EHS upgrades are going to be evaluated by our new division administrator. And that's going to be a priority of his, I believe. So we should have better updates on what path we're going to take with the EHS system upgrade a little bit later in the year. And then the employee retention that you guys had approved, we won't see any activity on that until after December when the actual retention payout happens. So with all of the designations, less restricted funds, we have an undesignated unrestricted cash balance of about 2 million. It's a little bit up from July, and that would be due to getting the Ada County payment in August. We got about 1 million for their contribution in August. Any questions on the cash balance report?
Basically, I just, one question on the county side. Do you guys invoice the counties every quarter?
No, we do it annually. We send out an annual invoice in August, September timeframe, and then usually if we haven't received payment on the usual timeframes that the counties send payment in, we'll just give them a call and ask them if it's in process or
I
not.
just wonder if it might help remind folks that they have a payment coming up from the counties.
Yeah,
'Cause that can get dropped.
I had actually contemplated that, and I had a brief conversation with Russ, but we hadn't fully come to a decision on actually requesting that the counties pay on a more regular basis instead of at their leisure, because we let them do it on their own schedule currently. But several other health districts do have that model where they bill them at a more regular interval for the quarterly increments instead of doing it just annually. So it is something that we could do.
I'm just wondering if this would be something for executive council to talk about policy that all the districts could bill monthly or quarterly. Because most clerk's office, it's all claims, it's all, they got to see something coming in before they're going to get it.
Madam Chair.
Yes, go ahead, Rob.
Yeah, it's something we've definitely talked about, as Bailey said, through the years. And Ada County was the one we reached out to because that's where the largest amount of revenue is coming in, county contribution. And I don't recall their preference was they just continue to pay us as they always have. And we've never had any issues with it. And coming up on 17 years that I've been here. So I don't know that there's a solution needed. You know, I think if I understand it for cash flow, but we haven't had issues with cash flow. It's actually going to be a little bit more leveled out because the state appropriation came in twice a year, July 1, January 1 timeframe, and that's gone. That's all shifted over to the counties now. What's the frequency of Ada County payments?
It's biannual, so
Okay,
So it's after taxes are collected in June and December, and then they probably have enough money to send.
Yeah.
Yeah, it's usually January and about July that the payments come in, so.
Madam Chair, just to make a point.
Yes, go ahead.
I don't think we take this to the executive council. If this wants to be a policy for our board, then it could be a policy for our district. I could care less what Teton County thinks about how
No,
payments
but
should be
it-
made, I guess.
It would
is
be
what
really nice if we all did the same thing throughout the state.
I completely disagree. I think that we need to maintain our own governance here if we want to make those changes. That's great. I don't think you go hand in hand out to other counties.
So just to give you some background, I have talked to Troy at L District 3 and they bill monthly, and he says it's kind of a little bit of a headache to do it at that frequency. So I don't know if I would want to do it monthly just for my staff, but I think quarterly could be an option. But as Russ said, we haven't had major cash flow issues where our undesignated balance is being drawn down to a very low level. So if that becomes an issue, then I think that we could revisit this discussion, but as of right now, it hasn't been an issue.
So if it ain't broke, don't fix it.
I mean, we get grant revenue that comes in monthly, so it's not like we're only getting these big giant payments a few times a year. We get, you know, probably between $500,000 to $1 million monthly in program contract revenue. So I don't think it's an issue.
Well, as long as it doesn't affect our cash flow, I think we're all right. But if we get to that point, I would not be offended if we decided to bill quarterly, semi-annually or something. But I just know from the clerk's perspective, they like to see that claim come in. it reminds them what they got, because there's hundreds of those.
Yeah.
Yeah, and we do call them if we
Okay.
haven't received payment in the time that we would have expected them to have paid it. So like if they normally pay in May and May comes and goes, and in June we are calling them saying, hey, we haven't seen your payment, you normally pay in May. Can you give us a status on that? And then they usually pay it right away after we give them a call. It's usually not much of a fuss.
No, where it comes back and bites you, some accounts, they charge you a late fee,
Right, yeah.
and we don't want to be paying late fees.
No.
It's just a communication error.
Yeah, so we haven't been in the
Haven't done that
practice
yet,
of
but-
charging late fees, so.
Other entities do, so.
I mean, maybe if we were having a hard time when we were calling with the reminders that payment was due, then we might consider it, but usually once the reminder comes, it gets paid, so I don't think that there's any point in deleting the relationship with trying to add late fees on.
Does that conclude your report?
Yes, yes, that's nice.
Thank you. Any questions, concerns? Okay. Thank you so much.
Yes, thank you guys.
Hey, Russ, so I guess we're going to let Elle talk now about food fees.
Thought we were talking about.
No, you gotta do this. Number 5.
Mm-hmm. What? Oh, I've got the old one? Yeah. Oh, okay.
Sorry.
All right, all right, okay. All right. Well, it looks like it's going to be Megan and Raul.
You go first, or do you want to, how do you want to do this?
Go ahead.
Well, we've just been talking on the side based upon what recent events where Central District Health had a sponsorship and it didn't necessarily go over well with the community, as evidenced by the phone calls and emails and comments that we had. And when I was talking to Raul, we were talking about how maybe the best path forward is to not even have to make a decision where it's appropriate to use a sponsorship or the logo or the name of Central District Health for any other entities' events. So that the only time you use the Central District Health logo name, all of that is for events that are conducted by Central District Health. That doesn't mean a lack of participation in events. That just means that those logos, the name cannot be used for other people's promotional purposes. And I think that was, I don't know if there's anything you want to elaborate on.
Russ, you and I had a long discussion about this, and there's a difference between wanting to provide services to the community and sponsoring an event. And I think we understood what you were trying to do at that event, but then it comes out as if it's been a sponsorship, not just from Central District Health, but from the government. And which is what they were trying to do. They were trying to promote it as the government is sponsoring what we're doing here. And I think there has to be a separation between something that is sponsored by CDH and something where you're just getting a table or a booth. And I think there should be a policy for that. And if it's going to go beyond what the Central District Health is sponsoring, our own events, then I think it should be approved by the board before a logo is allowed to be used at any of these events.
Are we still thinking we attend for education purposes at like fair, Air Force Appreciation Day, those things?
I think that the problem is not participation. The
Correct.
problem is other people using our information to promote their event.
Yeah.
So they're using taxpayer entities to promote a private event. So I don't think that the complaint necessarily is participation in these, because I think when I was getting the phone calls, once I explained what the purpose was to be there, to be informational. This is public health. We're not endorsing any of the activities. What we're trying to do is provide resources to folks, period. And that's why when we were talking about it, I thought that maybe the solution is just to say, you cannot use us for your promotional.
Yeah.
I mean, it's just the same as there's an old story about a former governor who very specific feels about this kind of thing, who was at a rodeo and saw that there was a government entity sponsoring the rodeo, and he turned to his neighbor and said, well, I certainly hope they didn't use taxpayer money for that. And so I think that that's, that if we draw the bright line that says, yeah, we're perfectly willing to participate in your event, you can't use us on your promotional information. And that doesn't mean that we can't put on the website, hey, we will be here for these purposes. It just means that other people can't use us to provide legitimacy for their private event.
Correct, correct. And I had the same conversations where people would call me and I said, this is why it's there. This is what they were trying to accomplish. And I think what people were bothered by is that then it seemed like the government was sponsoring the particular event.
Right.
So we just need to fix that.
Well, and my response to the phone calls I was getting was, we are there to educate and treat, period.
Yeah.
So, Madam Chair, my question, I guess, for Russ is, do we sponsor any events? Not be there and give education, but actually sponsor events. Maybe what we need to do is list, these are the things that we would sponsor, and then anything more would have to go through board approval.
So, Madam Chair.
Yes, please.
So as a result of this event in September, I created an event sponsorship policy, which I think you all got a copy of. And the idea behind that was to avoid that circumstance from ever occurring again. So when I think about it's specific in the policy, I provided examples like Idaho's Breastfeeding Summit. They may ask for the public health districts to sponsor, to help contribute so that they can conduct that. It's specifically for a public health purpose. Yes, we have sponsored those in the past, and yes, we've allowed them to use our logo with our logo criteria, can't be changed. So that's the types of events where I would envision per our policy that we would allow an organization or an event to use because I think it's a good thing. We're there, it's part of WIC, it's a big deal, it's for the health of moms and babies. Any broad scope, which we do those also, like Air Force Appreciation Days. I don't recall, this was different. This was a professional agreement that we signed to be there, and with that professional agreement, to have a booth, basically, that's what we do. They also provided the sponsor, that you would be listed as a sponsor. And that's where things went sideways. So with our policy, and I could add some language to that. So essentially, broad scope community, CUNA days, Idaho City days, we're not going to be a sponsor. Will not be listed as a sponsor. If we must be listed as a sponsor in order to have a booth, we won't participate. That's what our policy says now. To add to that, based on this conversation, is participation at broad scope communities, broad scope community events. We just won't allow the use of our logo. But I like the idea of the Idaho Conference on Alcohol and Drug Dependency, that we are there and that we can contribute some money to that, because we would be paying for this anyway. It's just capitalizing on these big community events and statewide events rather than us trying to conduct it ourselves with limited interest versus some other organization with a specific public health purpose that we be there and show our support.
Are those events they're already government events, so the state is putting them together, or?
It varies. Some are, and some would be from community-based organizations, nonprofits that would put the event together.
To that point, I think there's a vaccination group that's putting together a certain, it's coming out, there's an event that they're putting together, and I don't know if it's for flu vaccine or what exactly they're wanting to vaccinate for. And while I think it's fine, and it's a private entity, and I would believe that we're probably involved, I don't know, but this is why I think there needs to be a brighter line, and that we shouldn't have private entities, with the ability to use the name and the logo to self-promote. That's just the line, and I don't care how fantastic the project is. The line should be, you cannot use us to promote your project if you're a private entity. I think that's different to the point of if it is a WIC something,
Correct.
then yeah, I mean, and I also don't think there's anything wrong with putting on social media or however we want to promote, we will be at. I think that's different to say that, you know, we're going to participate in this event and take that upon ourselves. But I just think fundamentally, private entities shouldn't be able to use logos and names of taxpayer-funded entities to promote their own private agenda, regardless of how helpful that agenda may or may not be.
Yes, go
Would
ahead.
money go along with that then? Like we would not support anything aside from the, I mean, the logo is over here and the.
No, I'm not addressing what money we're talking about. If you want to donate, what I'm saying is don't use us to promote yourself. That's where I'm trying to draw the line of, if they had wanted in this earlier event, if they wanted to charge just for booth space and we were kept off the promotional and we had paid for, which was what the initial thought was, according to my understanding, right? It was that we wanted booth space so that we could provide information that I think 95%, if not all of us around this table, would argue that it was helpful to have at that event. The problem was they used us to self-promote. And so for me, it's not about the money or the donation or to buy the booth space, because if we want to be in Valley County and need a booth space, that's fine. My issue, and this is what I thought we talked about, if you are disagreeing with me, please pop in, but it's that private events shouldn't use us to promote their private events. And I think that's the whole crux of where we got sidetracked.
And I would just go one step further. Why are we donating? I mean, you say donation. I think booth, you know, if we need to pay to participate and get a booth, I don't have a problem with that. But why are we as a government entity donating to any private entity? So unless it's for the need that we have, which is to promote public health in the community, we shouldn't be adding any more. Are there opportunities where we give money where you think is justified? I guess I'm not really clear on that.
I was thinking about, what was it, 4 years ago, 5 years ago, maybe? Because I was thinking about that when they brought the green bikes and they were asking us, remember that? They were asking us for a donation for downtown, and there was a bit of a fight around the table. Boise, city of Boise wanted us to donate, and there were some individuals that were on the board at the time that really wanted the donation made. If I remember correctly, we did not make the donation, but I would have to go back and look. But
it did nothing for the adjacent counties.
Yeah, and so that's, you know.
Yeah, those are kinds of things
That's
that I
the
think
kind
we
of
should be
thing.
brought to the table and not just, you know, let's just give money to this project. But if we need to have a booth anywhere in the state, then we should be paying for that, as long as they're not using our logo to promote their event.
I did have an idea here too, up on the sponsorship title here, a sporting or artistic event. Maybe use some term that would refer to more community events rather than just sports and art festivals.
So, like I was saying, I just think there's the, like the Idaho Breastfeeding Coalition, which we're members of, we participate in, and if they have an annual conference where they're bringing in lactation consultants, and they would like an organization like Central District Health to contribute to that so that they can basically fund the event, get the space at whatever facility they're going to use, and usually they charge fees to try to cover their cost. But those would be the types of events that be a nonprofit organization where we'd actually provide a sponsorship to
That's
make a
different
contribution.
to me, because if we're a member of that organization, then that's a little bit different than if we were just having a community event. So if we're already a member of that organization and we want to participate, it'd be like participating in NALBO or whatever group we're already a member of the organization.
What's the difference in paying to participate, sponsoring that?
Right.
Or paying.
Right.
And I think in this case, this past case, we were kind of misled on that.
Yeah.
Oh, I don't think
I don't know that we were misled. I think that there was some deliberate action and wording of the contract.
Probably.
Yeah.
So, so that's what I guess just make that, I want to make sure I'm clear. I guess you guys decide what you want to do with this. The other example is Idaho Conference on Alcohol and Drug Dependency. That's something that came up recently. And they may ask for CDH to contribute to that event. We're not members of it, but as I look at it, it's a subject that's really important to public health. The board approval, it's great. It's just a matter of sometimes these things come up, and if we don't meet, our last meeting is in May, budget hearing, and then we don't meet again until August. I don't know, it's just timing. That's the only big gap in time between board meetings where we may not have that opportunity to, but you could call it a quick meeting, do it virtually, as far as us sponsoring. So as was discussed, some of these events allow us to be there for free. Most of the time they charge us some fee, a couple $100 to have a booth. And I guess that's what I'm trying to understand. So if we have a booth at the Air Force Appreciation Days, typically they may put our logo on the flyer, Central District Health Booth 23. Sometimes they do that. Hyde Park Street Fair, they'll include that information on the event schedule.
But not the promotional. Like, I don't think they need to use our logo to say CDH will have a booth here.
Yeah.
There's just no need to use our logo for that. Okay. It's just CDH. I don't think people go, oh, CDH. Oh, now I see the logo. Now I know what that is. I think if you ask me what our logo looks like, I have no idea. So I think it's just saying Central District Health will have a booth here. We're talking about promotional stuff, not just letting people know who's going to be.
When you're listed as a silver sponsor,
Yes.
very clearly promotional, right?
Yeah.
Okay.
Madam Chair, I guess my feeling right now is I think, you've done a great job of filtering these out over the years. We've never had an issue before. This one popped up. We learned from it. I don't know if we really need policy that says, hey, those have all got to be board approved. I think we can leave that up to you. That's my feeling.
I want a policy that says that we will not be used in promotional materials for private entities.
Yes.
I feel strongly about that. Whether you want to walk back, how we decide, when we can participate with money or not, but I think that we need it in the policy that says that. And if you want me to make that type of motion, I could do that. Or if you want the opportunity to rewrite the policy and bring it back to the board, we could do that as well. It's up to you, Russ. What would you like me to do?
Madam Chair, I think if ELP has a different opinion, so probably ought to make a motion and vote on it and provide the direction, and then based on the outcome of that, I'll revise the policy based on the direction that you all decide. Is that fair?
And I'll make the motion, that Central District's name and logo should not be used in promotional materials for private events or private entities.
You want a policy that says that?
Yeah, I do. After the phone calls and the angst people have, I would like a policy that does.
And I will second the motion, and I will add that if you start picking and choosing which events you can use the logo for and not use the logo for, then you're going to get into some legal issues and other issues that you just want to avoid. And I think the best thing is to just have a flat policy instead of saying today we're going to use the logo for this, but tomorrow we're not going to use the logo for some other event.
And I guess what I'm saying is I think Russ is very capable of doing that.
Well, what we're saying
Without
is that he could actually get in trouble for
Yeah.
if
This
has.
gives him a backstop.
Yeah.
That this is the board policy, that I cannot do that. So if the event in question had come and said, well, we're going to use you in our promotional, you could say, I'm sorry, I just can't participate. It's not you, it's the policy. So that would be my argument.
Okay, the motion's been made and seconded. Is there any further discussion before I call for a vote?
So this is just the logo
Correct.
as promotion, nothing about money or participation or anything.
Okay, I'll call for a vote now, starting with Dr. Young.
Go, Jamie.
Jane Young, aye.
Raul, aye. Dr. Cole's absent, Boise County's absent.
think-
I'm here. Dr.
He's
Cole's
off.
here.
He's off.
Oh,
I've been here the whole time, sorry.
Yeah.
I'm just traveling as usual, so, my vote is aye, thank you.
Okay, Megan, Elmore County,
Elmore County, aye.
Valley County.
No.
Okay, the motion does pass, Charlie, so, okay. Now, Elk can talk about the food fee.
So we had an executive council, I can't remember what day it was here, about a month ago. We talked a great deal about that. There is some push from Doug Zenner's district. What is that? Two. That they may be trying to find some legislators to bring this forward to get it out of state code and in control of us and the counties to set food fees. I talked to Megan here in between all that, and she felt like that this is not a good year to bring this forward as it is an election year. And so the executive council decided to kind of hang loose and see what the election does, and then we'll get together after that if we want to proceed. So that's kind of where we are.
Okay,
That's it.
okay. Any discussion regarding the food fee issue? So, okay, proceeding. Russ, you want to give us a ARPA funding nurse family partnership update?
Sure. So we talked a bit about this just with Hayden's presentation, and that was specific to nurse family partnership, but we put in requests to Ada County. They solicited the community to submit proposals for projects that align with the proper use of the American Rescue Plan Act funds. We submitted that. It actually started back in the end of 2021, and then they funded Ada County Department projects first and then took on community proposals. So we're sort of at the final phase of that. Not sort of, we should have the contracts to us next week signed, and then I think November 1st is when the Board of Commissioners were going to provide final authorization and sign the contracts. They'll already have my signature on them. And it's a large amount of money. It's a total of about $4,770,000 to be used by the end of December of 2024. There's parents as teachers, nurse family partnership, smaller funding for harm reduction, which is just an extension of a lot of the work we're already doing with the opioid situation, opioid overdoses in Idaho. And can't remember, it's 80 some deaths, I think, last year due to in Ada County alone from opioid overdose. So it's really quite significantly impacted.
I'm sorry, how many did you say?
80, I'll look up the exact number. So this was in 2020. There were 287 fatal drug overdose deaths, 87 of those fatalities in Ada County.
And that's a huge increase, right?
That's a huge increase.
Yeah.
Exactly. So there'll be harm reduction and then a student and family assistance program, which is kind of modeled after the employee assistance program a lot of workplaces have. And we're receiving funding to work with schools in Ada County. And we'll work with BPA, which is a big contractor for employee assistance programs. So we're really excited about that. It's new, and that's when Bailey talked about the trustee and benefit money. That money will be going out to the schools and to BPA to support the schools, and we'll be providing helping provide educational materials and make community connections so that it's utilized. And that really focuses on the impact that COVID and schools and kids having to work in a study in a hybrid or fully remote work environment and the mental health impact of that. And then there's that's 3.7 million. So again, it's the largest share of the funding we're getting from Ada County. And then there's a screening, brief intervention, and referral to treatment program that we're also doing, working with schools in Ada County and after-school programs and school-based organizations to provide training to them so that they can identify substance use. So that's what that program is for. Yeah, so it's pretty exciting. It's a very large amount of money and it'll allow us to get these programs started. And, then the question always is the sustainability once the ARPA funds run out. So that's something we'll be looking at, see if there's other grant opportunities to continue to make that work. Like some schools, they may have other funding streams that they can use for the Student Family Assistance Program, the EAP program that will be used for students and their families. Hopefully it'll be successful.
Madam Chair, just a quick question. Russ, does this money, and maybe you said this and I missed it, include the opioid funding that Ada County got as well? Because that's the issue like we're having in Valley County. Where can we spend that? Just only the opioid fund, not the ARPA funds that we got last year. And it's been really hard to figure out where to spend that.
It does not include, it's only the American Rescue Plan Act funds.
Well, that money is basically still sitting there somewhere unless Ada County did a crisis center or something like that.
Yeah, I'm not sure what each county's going to do with the funding they receive. We are getting a direct appropriation from the lawsuit.
Well, and was it my understanding too that a lot of those appropriations, they transferred to us for treatment?
Could have, but I think Star, you guys, or Bailey, do you remember? I think Star transferred their appropriation, the opioid settlement money to us, but I don't know that anybody else did.
This is such a huge amount of money and I'm not hearing anything.
Well, and that's the issue, I'm sorry, the county challenge, we don't have anywhere to go with this funds unless we have a crisis center, and then we could throw a lot of money at that, which we don't. So I'm gonna look into that and see what we're doing with ours, because I think that's just kind of slid off the table.
Yeah.
Yeah, and we're looking at things like medication-assisted treatment, that's medication-assisted therapy for individuals who are struggling with substance use disorder, primarily opioid use disorder. So that's what we plan to do with our money. So if there is interest by counties or cities that they want to do some type of partnership, we'd be interested in talking about
And
it.
we had a person up there, and then she passed away. So
Right.
we don't have anybody that's doing that, right?
Right.
That's right.
So we're looking at expanding out as an access point through Stephanie's team, making sure our staff are trained and doing it in person and offering virtual visits as well. So if that's something of interest to your counties or cities within your counties, because they also received opioid settlement money, we're glad to talk.
Okay, we'll let you know.
I'd like to hear more on that. It seems like it kind of stalled out.
Yeah, and I will say this sort of the stalled out part is the money was supposed to get here whenever it was, and then it was April, and then, it just took a long time, which I get, as far as it's a large dollar amount when I don't even know how many states do you know
States what?
were part of that lawsuit. By more than
don't.
half, I think.
Yeah.
So Idaho.
Well, and then the way I understand it, as other industries, other pharmacies get sued and have to contribute, this is going to be an 18-year kind of a long, drawn-out deal. So there's a great opportunity there to build some long-term programs.
Right.
With this, and that money could go up as more brought into the lawsuit.
Yeah, I think we're getting around $252,000 a year for 18 years. So that's part of this lawsuit. And then what you're referring to is other industries. It'll be full distributors, manufacturers that will be brought into future lawsuits. And that's what we've heard, that the dollar amount would increase. It won't go down. I mean, pretty much, as I understand, guarantee for 18 years to receive $250,000 a year at Central District Health.
From that one settlement.
Right.
But there are other settlements in process. In fact, I think
They're coming out.
I think Pfizer just had a settlement for 38 billion or something like that. But that money should be coming too, so
The states, right?
to the states, I'm assuming the same as everybody else.
There's lots of strings.
Oh, man, yeah.
Yeah, so it's extensive and it has to be used for substance use prevention, substance use treatment. So you can't use it for nurse-family partnership. I mean, those are the things that it would be, as I read the restrictions, that would not be allowable unless the family we were working with what we're addicted to.
Issues.
Yeah, so
But you can't use it for alcohol abuse or marijuana abuse. It has
Opioid.
opioid.
that's right.
And that's the tough.
And should there be future lawsuits by Idaho, it would be desirable to allow the state to use it for other public health needs, in my opinion, but
Just remember that when you get in there. We're talking to you, Raul. You get that one?
I heard it.
Not that anybody's making any assumptions.
I heard it. But it would be, because it's a tough issue, and we do have other federal funding streams. We got the money coming from Ada County through ARPA, and looking out 18 years, we have no idea how serious of a problem this might be. I mean, if we're really successful, there's going to be plenty of other public health issues that we need to address, and it would be nice to be able to have a little more flexibility with the money.
Yes, because actually the drug addiction, I mean, if that's includes a lot of things other than opioids.
That's right. Yeah.
So.
The only other thing I was going to mention under the director report is we will be setting the 2023 meeting calendar, and it'll look pretty much the same as it has for the last forever, as far as the frequency of meetings. And if winter and spring we meet more frequently, you have the legislative session and then budget setting process, then the actual budget approval in May. June is the annual Idaho Association of Local Boards of Health meeting, which is being hosted by Public Health District 1 out of Coeur d'Alene. So we don't have the dates for that, but usually it's in early June.
You do, I'll look, you go ahead.
Yeah, so we'll get that sent out to you.
They want to have it in person
They
too.
want to have it in person.
Right. So we'll get the schedule sent out to you, and what's really helpful, I know it's impossible for you all to know exactly what your schedule is going to be for the entire calendar year, but if you know of conflicts, if you could even let us know ahead of the December meeting, then we can make some adjustments to the schedule so we can get it finalized and published.
It's actually planned for the evening of June 8th and all of Friday, June 9th. There's an IAC conference in Moscow, the 6th, 7th, and 8th, and then they want to take off from that and do the 9th.
Okay.
Should have brought that up during my report. I'm sorry, but.
Now, as I recall, in our IAB meeting that we hosted, they want to have it in person, but there was quite a pushback from other districts saying, hey, the expenses associated with this are just not.
So, well, and part of that discussion, what's Glenn's last name?
Bailey.
Thank you. Talked about that they weren't sure they were going to offer that option.
Well, maybe we're not sure we're gonna write a check for them.
They want people to show up there. And if we're gonna be in Moscow, we'll go on up there.
Well, you'll be in
You'll
Moscow.
be in Moscow.
None of the rest of us will be in Moscow.
Well, we could take the Lear up and.
If I may, Madam Chairman, I would tell your colleagues on the executive board.
You can tell them.
I think that then we can scale back what we participate, the money with which we participate, if they're unwilling to provide a virtual option, and we will pay for Elle to go.
Well, I know we had a long discussion about, do we even need an executive board? We don't need trustees anymore because that function is gone. So the whole meeting is going to be basically of resolutions and up or down of resolutions, and then, I don't know, like new officers or something, and then that would be it. So it's like, this is a long drive to go to Coeur d'Alene for that kind of meeting.
To talk about resolutions that are usually good ideas, but don't go anyplace.
The same thing is kind of happening in Idaho Association of Counties. A lot of resolutions coming out there, but I don't see any of them anywhere. But you have to do it because you signed up for it.
Sharon, can we maybe put that on a discussion item for a future meeting about what kind of funds we need to provide to the Idaho Boards of Health?
What is it now, $700?
I don't know.
Oh my God, $1,200?
I'm just saying, if it sounds as if what we're moving to is that it's just an association to belong to, just like NALBO is. and we made a decision not to participate in that. And if what they're providing is a meeting and not any sort of educational resources or something like that, that is worth, yeah, and we don't need to be going on a vacation because of public health, yeah.
Well, and it's kind of reached a point, honestly, when we talk about the food fees, some of us felt like, let's wait till after an election year and then maybe hit it hard next year, and others felt totally the opposite. That they wanted to get this out in front of the election to see how people felt, and so there's not a lot of cohesiveness or general agreement on the board now as it is. Took all of about, I don't know, 15 minutes on Zoom.
Well,
Right.
and my understanding based upon code changes, it's completely voluntary right now. Unless there's something that we choose, that the legislature chooses to fund and send to that board, there's.
Well, the biggest, issue this year was the food fees, and everybody thought we should all, well, not everybody. Some folks felt like we should attack it this year, and some folks, they're gonna go ahead and try and get their local legislators to run legislation. There's a couple of guys from Eastern Idaho, and I don't know if that's gonna happen or not. I kind of seriously doubt it, but we're kind of coming apart at the seams, I guess, to make a long story short.
Chair, well, I would argue that's because the board had a job. It's kind of like the tagline, what we always do with the legislature, we have two jobs. We appropriate money and we review the rules. Those are the constitutional responsibilities. The sole responsibility of the board was to distribute money.
Yeah, the formula.
The formula, and that's gone away. And that was a hard fight. Yes. Thank you very much. And so I, of course, because I got stuck, I have strong feelings about it. And I don't want to be held hostage to, hold these meetings that's nice to have a collaborative meeting. I don't think there's anything wrong with having a Zoom collaborative meeting, but I don't like the idea that we're being held hostage to go to a meeting for a group that doesn't really even exist anymore. Right. That I feel better now that I've said it out loud.
Well, and a lot of my recommendations to the board were.
That's when I get in trouble.
To me, this is not a year to take on food fees, so that's, and I understand all that, but it would be, again, you guys could do proxies and I can vote for you, do all that if I decide to go.
So, Madam Chair,
Yes, go ahead.
so there's kind of three tiers, three groups. You got the Idaho Association of Local Boards of Health, which is voluntary. There's bylaws. You voluntarily agree to get together. Historically, what they were used for, speaking of the 14 years ago when we hosted it, was educational. So you bring in speakers and talk about various subjects of public health interest. So it was more of a Idaho-based national conference, but Idaho specific, bringing speakers from within Idaho and outside of Idaho. So the business meeting was kind of a short portion of that. And then it was really after COVID hit that it become strictly the business meeting, and that was resolutions, voting on the contract with the Idaho Association of Counties. That's maybe what you're talking about. I think we pay about.
Yep, I think that's part.
$2,500 a year, our contribution.
12,000 for all 7 districts.
Correct. Is that what it is? 12,000?
I think so. It was 12,000.
So there's that. And then the board also voted on their annual budget, and that budget was to pay for IAC, the contract, but it was also to help fund future annual meetings for speakers and food. And Donna, you were really involved in that, not this last time, but the prior 2 times. So
I will say our district, out of 2 times that we've had it, we had enough money for the fees that we charged, that we always gave money to it. So we
Right.
never used money out of the budget.
we based our participation fee. So if you were the only one to attend, you would be the only one to pay the fee. So we had to figure out, structure the fees based on likely attendance, not based on 54 or however many board members there are statewide anyway. So you got the high level structure, Idaho Association of Local Boards of Health. And the other group was the Board of Trustees, and that's an Idaho code. And they are to set the state appropriation, which ended up being state appropriated money to include Millennium Fund dollars. We did change because the original formula that was put in code for the home visitation funds, that deferred back to the Board of Trustees. And then this year, that was just the Board of Trustees voting and giving that to the Department of Health and Welfare, because the legislature did no, for home visiting, it was not defined what each health district would get as it was from the start of that 5 years ago, 6 years ago, 4 years ago. It was a while ago.
Yeah, it was. It was 5 years ago.
So there still is that component for the Board of Trustees to meet and discuss a formula, not on the state appropriation, because that it's general state aid, that's gone. So.
It's just the Millennium Fund.
And home visitation.
And home visitation.
Right. So unless there was the appropriation language was very specific, health, and it goes to health and welfare, most of it. There is Millennium Fund dollars this year that we were appropriated directly for focused on vaping in schools. So Idaho Association of Local Boards of Health, Board of Trustees, and the Executive Council was created because the trustees were voting on resolutions and doing all kind of stuff that they shouldn't have been doing per Idaho code. They had one job. So the Executive Council meets and talks about things like, should we try to work on food establishment license fees this year on behalf of the Idaho Association of Local Boards of Health, because that group only meets once a year.
And I think this is the last year for me as trustee. I think I time out.
Yeah.
Unless you change the bylaws.
Yeah.
No, I think we just need a new trustee.
No, absolutely not. I would abolish the whole thing as fast as I
I
could.
understand.
I move that you.
I've been looking for the elimination of this for years. It's no secret. I think if what we want to, that's why I say maybe we need to put this as a discussion item.
Okay.
Because,
For December.
I mean, and because Elle's done some good work on there.
Yes.
But it's reached the point where
It's reached the point that it's just.
we don't have any more meat left. I mean,
Right,
there's
yeah.
nothing really we decide.
Yeah.
Like you got baptized by fire.
Yeah.
It's good for the engineer.
Yeah.
It's good.
Oh,
Well, and I guess, what's been wrestling in my mind is, if we disband or do away with it, are we gonna lose our cohesiveness as an overall public health district? Are we gonna have other districts doing their thing and this district doing the opposite, and we're gonna clash somewhere someday? That's my concern. It brings legitimacy to our organization.
I
But-
disagree, but
But if you don't do anything,
yeah,
it's just a boat ride around Coeur d'Alene Lake and have a good dinner and come home.
Right.
well,
It's not worth it.
yeah.
There was a fourth component to that that's now gone, which is so you got the State Association of Idaho Local Boards of Health, Board of Trustees, Executive Council, then there was the State Association representative on NALBO's state affiliate group. So that fourth tier was voted out during
And
this last
Megan
meeting.
was the last one. wasn't
That's
she?
right.
Yeah.
If you just want me to take jobs to get rid of them, I mean, I'm fine. I have a list of constitutional offices I will discuss with
So how-
Raul that I would love to see go
How
by
do we
the
do
wayside.
resolutions as a group? How would that function get done?
If CDH chose to not participate in the Idaho Association of Local Boards of Health, then we would participate in the resolution development process. That's where that happens.
And that's kind of where it really happens now.
Right, at the business meeting is when that gets decided.
Believe me, I don't want to go through another meeting.
Sounds like you're really excited.
Yeah.
Well, Gemini, he's kind of gotten into
I'm
that.
having a hard time gauging where you're at.
Just wants that boat trip.
That's right.
Well, I'm actually looking for the meal, if you want to know the.
We'll put that on the December agenda to discuss.
When's our next meeting?
It's December 16th.
That's the Christmas one. Are we gonna do anything for Christmas meeting?
Have to ask Donna.
Pressure.
I'll take care of you. You're welcome.
Well, it's honey time.
That was it.
Through.
Yes.
Well, I'm going to make an executive decision here to call for a 15-minute break. So we will adjourn again at, let's see, 25 after. So,
Thank you.
yes.
Constanza is a G. I'm shocked about that.
All right, we're back.
We're back.
We're live. Okay, just in your mouth. Okay. We'll convene our Central District Board of Health meeting again. And our next agenda item, we will be going into executive session under Idaho Code 74-2061B.
Do you need a
And
motion?
so we need to.
Madam, before we do that motion, I just want to make sure that the record reflects that Ryan has been on present the whole time.
Oh,
I
okay,
don't-
you got that done.
I do.
Yeah.
Okay.
Thank you.
So if we go into an executive session, it's just board members.
Right.
Right.
And you need the motion.
Are you ready?
Yes, I am. We'll take
Okay.
the road. Uh-huh.
I move that we enter executive session under Idaho Code 74-206, 1B to consider the evaluation, dismissal, or disciplining of, or to hear complaints or charges brought against a public officer, employee, staff member, or individual agent or public school students.
Okay, thank you.
I'll second, Madam Chair.
Okay, thank you. I will take a vote by roll call, starting with Ada County, Dr. Young.
Yeah, aye.
Raul,
Aye.
Dr. Cole.
Aye.
Boise County is absent. Elmore County, Megan.
Aye.
Valley County.
Aye.
Okay, thank you. That motion passes and we are in executive session, so.
We need to put Dr. Cole on
Burley, yeah,
Are we ready?
but I'm hitting 2 or 3 counties on the way.
Yeah, good.
Hold on. All right, we're live.
Okay, thank you. We're back live, folks that are listening in remotely. We have just come out of, we're coming out of executive session. We'll entertain a motion at this time.
Do we need to do roll call again, Donna, or go ahead?
You do roll call after me.
You don't have to roll call.
Okay.
You just state when you came in for out of executive session.
Okay.
So, Madam Chair, I would like to make a motion that we authorize the increased salary for our district director, another $1 an hour with a $2,500 one-time bonus
And I'll second it.
for a total of $4,580.
The motion has been made and seconded, and I will take vote by roll call. Ada County,
Jane Young, aye.
Rowell,
Aye.
Dr. Cole,
Aye.
Boise County is absent, Elmer,
Aye.
Valley County.
Aye.
Okay, that motion does pass for those amounts.
Thank you. Yeah, thank you. We appreciate the work that you're doing.
Yes, we do.
Yeah,
We do. Good job. And I think your evaluation's really good.
yes, thank you so much.
And you're good in teach them this year. You feel sorry.
So are you looking for a motion to adjourn then?
Yes,
Madam
we
Chair?
are.
I would so move.
Second.
Okay, the motion's been moved and seconded for adjournment. For those listening in remotely, we appreciate your participation. And our next regularly scheduled meeting is the 16th of December at 8:30 in the morning. And we do have a motion on the table as well as a second for adjournment. So I will take a roll call vote, starting with Ada County, Dr. Young,
Aye.
Rowell,
Aye.
Dr. Cole,
Aye.
Boise County is absent, Elmer County,
Aye.
Valley County.
Aye.
Okay, thank you, folks. We stand adjourned. Great weekend.
Donna, Donna,